I'll call this Board of Health meeting for June 20th to order. I'll just make this statement first. This is a public meeting of the Needham Board of Health. The meeting is open to the public both in person and via Zoom. Residents are invited to provide comment during the public comment period is set forth below, and for any item explicitly listed as a public hearing. Public comment is not available during other agenda items, right? So the meeting is called to order, and I'll take attendance at this point. So I'll start with you, Artie.
Hi, ready?
Okay, Ed Cosgrove, Steve Epstein, and Tejal and Rob Parker, Joe.
Michelle is actually here, but she
Oh.
hasn't accepted
Okay.
my promotion to panelist yet.
Okay. Let's get it there.
Mr. Chair, we did not receive any requests for public comment, although we did receive people who did want to speak at the public hearing.
Okay,
So we had a general public comment period and no one's expressed interest to speak during that period.
Okay, I was talking with Ed about this, but regarding the public comment period,
Mhm.
if we might want to get a legal opinion on this, but I would suggest that we restrict that to residents of Needham.
Okay,
That's really the intent of this, and it's rapidly become a public hearing from outside interests, not residents of the town.
yeah,
And I think we should restrict it to people who are actually are residents of Needham.
okay, I can ask town council.
Okay, thank you.
okay, that's good. Okay, we're here for a review of the minutes. Has everybody read the minutes? Anybody?
Yes, move approval.
Yes. Second,
Okay, I'll take a vote. Marty?
I approve the minutes.
Yes.
Steve is yes.
Yes, okay. So those were approved. And we're starting now on the synthetic turf retesting. So I guess I'll let you start with that, Karen.
Yes, so we were able to have Evan and Neil join us, and they put together a little slide presentation briefly, but they will share that with the board. So I might as well turn it over to them.
Okay,
They're
They're
just coming in.
they're available, yep.
Well,
We'll be able to
I
answer.
think is fine, but arsenic, I have all sorts of questions. It sounds like they're still having trouble
Right,
actually, and I don't, is this, did they get rid of the old analyzer or something?
that would be the questions you could, that's why I knew that we might get more questions that they could answer directly on that. So they're willing to answer any questions you have on the test results.
Hey there, can you hear me? This is Evan.
Yes,
yes, we can hear you.
Great. So I think I can probably just share my screen and present a little PowerPoint, or says sharing is not turned on. I'll send the request.
Should be all set. But you have to stop sharing.
Okay.
Let's try that.
we can
Great.
see it just fine. It might be easier just to flip through the slides.
Okay. Great. Yeah, I guess I'll just leave it like this. You can see it just fine too. Don't want to mess up everything. Great. Yeah, thanks for allowing us the opportunity to join the meeting today and talk. My name's Evan Konsowitz, and I'm joined by my colleague, Neil Kelly. So that's us. I'm an environmental geologist here at FUS. Neil is our Eastern Mass licensed site professional. We do everything listed there in environmental, phase 1s, phase 2s, MCP compliance, and our firm does all those other services kind of listed on the bottom there. So if the Board of Health or any other of your Needham.
Oh, we lose Evan.
Yeah, I see it.
Seems like we lost him. Froze up.
Okay, I can still hear you.
Alrighty. All right, you're unfrozen, I believe.
Okay, sorry about that. I'm in our Boston office today. Great. Can you still hear me?
Yep.
Okay, awesome. So the project, we began sampling the crumb rubber on 3 different turf fields in Needham back in 2009. You can see the picture all the way on the right there. That's kind of the rubber beads embedded into the turf. This occurred at the high school, at Memorial Field, and Founders and Brock Field at DeFazio Park, kind of closer to the commuter rail there in Needham. We looked at 3 different kind of categories of compounds, VOCs, also known as volatile organic compounds, SVOC, semi-volatile organic compounds, and metals. And these were tested using kind of 2 different tests. The VOCs, there were a closed container test where when we sent it to the lab, they had the crumb rubber pieces sealed in a closed chamber. They heated it to 140 degrees and measured the VOCs coming off of the crumb rubber. For SVOCs, it was an open container test where they flowed air over the rubber and collected the SVOC measurements. And for metals, it was a dry weight test, kind of calculated depending on moisture content. In 2020, we proceeded and we updated and began comparing to Mass DEP risk-based standards. Before that, in 2018, we used OSHA permissible exposure limits, which were very outdated. They were determined in the 70s and are for job sites, not necessarily for turf fields or children. So the risk-based standards are they're derived from Mass DEP RCS1 residential soil standards. These RCS1 soil standards are based on the 4 criteria in the bullet points listed
Okay,
here.
Evan, you're going into jargon there. RCS, we're gonna need some definitions here as we're going.
Okay, yeah, definitely. RCS1 stands for Residential Soil Standards 1. It's kind of the strictest soil standards that Mass DEP has for residential, daycare, kind of those types of settings. So
RTS stands for reportable concentration standards.
I was wondering where that C was. Thank you.
Yep.
Yes. So Mass DEP, they look at all these 4 different areas and choose the highest concentration as their standard. So for example, for arsenic, arsenic is found in bedrock throughout New England. So usually Mass DEP, for at least in the arsenic example, they typically use the background in soil as opposed to the PQL or ceiling concentrations. For crumb rubber, we utilize Mass DEP's Method 3 residential short form for human health risk. And the short form defines these 2 kind of criteria, the excess lifetime cancer risk, or ELCR, and the hazard index as well.
Why are the different standards being used?
We kind of chose what Mass DEP chose. They have different, so some compounds are cancerous, like arsenic, and others are not. So they had a hazard index. So simply based on the criteria Mass DEP provided, they just didn't have like all.
So the Mass DEP wants to be conservative, okay? And so the ELCR is for compounds that are associated with causing cancer. Zinc is not. They don't have a ELCR number for that. They do have a hazard index, which is more of a short-term, non-cancer. So it's more about affecting target organs and things of that nature. They want to be conservative and more or less take the lowest conservative concentration that's going to potentially cause health effect. So soil standards, the natural background, obviously it's not soil, it's crumb rubber. So the natural background standards are applicable in this case. So it's usually therefore the lower of the cancer, ELCR or non-cancer hazardous index concentrations that we're looking at. I don't know if I answered that question correctly.
No, because like arsenic, for instance, you would never use a hazard index then, right? Because it's a cancer risk. So the hazard index wouldn't apply. So it sounds like you have different standards depending upon what you're testing. Is that
We
correct?
did.
Yes.
So if it has both an HI and an ELCR promulgated for a compound, we took the lower of the two.
Okay,
If it does not have an ELCR, we use the HI.
got it.
We did
Okay.
not use soil background numbers for our risk standards because they're not applicable. For zinc, for instance, processing tires, the zinc oxide is an additive in that rubber. So you're going to naturally have much higher levels in the chrome rubber than you would in naturally occurring soil. So the soil background concentrations aren't really applicable in this case. So we are using just the ELCR and the HI.
Got it. Okay, thank you.
Yeah, and for example, for arsenic, the ELCR is 2.5 milligrams per kilogram, while the hazard index is 3.7 milligrams per kilogram. So the hazard index is a higher concentration, but we chose to compare it to the lower cancer risk concentration in arsenic's case. So generally what we found over the time period that we sampled beginning in 2020, that VOCs and SVOCs were detected above laboratory reporting limits. However, those detected compounds were not above the risk-based standards we described below, which are the ELCR and HIs for different compounds, except for acetone and acetaldehyde in those years listed.
And I'd also like to point out that acetone and acetaldehyde are also known laboratory contaminants. They're solvents and used in the methodology in preparing the samples and or cleaning equipment. So those are sort of one-offs, and I have seen acetone over my career in multiple soil samples that is probably for most likely due to the laboratory preparation and how they are cleaning and working within the lab. So it's not necessarily.
Elevated levels that are probably that you think might be due to lab contamination. Are you rerunning those samples?
We have not rerun those samples, no.
I mean, it might make sense to do that, right? If you think it's if you think it's the lab prep.
Right. Well, so we can moving forward in the future. We can't have them rerun now because the hold times are well past.
Sure.
And they were detected just in those years. We didn't find them when we did retest in 2024. We found they were not above risk-based standards, but.
So historical data, if you look at white papers and reports for chrome rubber, acetone and acetaldehyde have been found in other sampling events. But they didn't really go into whether it's really from the rubber or looking at potentially lab contaminants. So it has been found in other studies. But it's typically limited in those studies. So we can definitely rerun things in the future if we run into those. Or we normally ask the lab to opine on that. I wasn't present when these in 2021 and 2023 with Fuss No Nil.
I just think that'd be a standard quality control, right?
It is usually, and I normally do reach out to a lab. I see acetone a lot, and I usually ask them to opine on that.
Yeah, and then for metals, we also similarly saw that there were detected compounds for metals. And generally they were below risk-based standards, except for arsenic and zinc, which we'll dive into.
Before we do that, Tim, we have a public hearing scheduled for 9:15.
Yeah.
We can delay that till we finish
You
this.
can delay that,
Okay.
yes.
Okay. Okay, we can go ahead.
Okay. So these are the results. They're apologies, they're kind of basic Excel tables. We have arsenic and zinc in the colors there, and our risk-based standard for each compound in orange. We have our years, and then our y-axis is concentration in milligrams per kilograms. So when we ran arsenic, all arsenic's values were not detected above laboratory reporting limits.
What does that
However,
mean?
It
Not
means
detected above laboratory reporting limits. What does that mean exactly?
So the laboratory has a certain reporting limit that the equipment is able to detect. And with confidence, the laboratory runs a lot of different analyses and comes up with confidence intervals to determine that they are confident there is no arsenic above that blue layer or that blue level, so the non-detect.
It's pretty much the reporting limits, the lowest concentration that they can detect a
Because
compound.
one of the questions that I have here is their lowest limit of being able to detect it not low enough for us? Because it's actually above the risk reported standard.
Right, so
Yeah.
the EPA sets method detection limits for all analysis methodologies. And that's based on what the gas chromatograph or whatever the instrument is capable of achieving. And then reporting limit is the detection limit. The detection limits sometimes have a margin of error. So the reporting limit is set by the laboratory based on the margin of error for the instrument. So you have an ND, it doesn't necessarily, if you're below the RL, it doesn't necessarily mean that there's nothing there. It just means that it's lower than what the instrument can readily quantify. So,
Right, and I mean, it's a little tough because this graph
And then-
obviously isn't to the
yeah,
scale. that
and then
we need.
sometimes
Right.
the analyses have matrix interference in them, which is something like proteins, lipids, salts, sediments that might interfere with like the gas chromatograph reading an accurate reading on that metal compound. So there's definitely, they run the methodology as best they can, but sometimes there is other things within the sample that may cause, a reading error.
No, I understand that. What we're trying to figure out is this even worth doing? Is this test worth anything to us? Because if the risk level is 2.5, but the detection limit is 3, then we could actually be over the limit and not be able to tell based on the laboratory analyses that you're running. And that doesn't help us because then we could have a cancer risk from these compounds in our fields, and we wouldn't know it based on what you've been doing so far. That's the question that we need to know the answer to.
Right, so, yes, you're 100% right. We can only do what is available.
Are there instruments that can detect it though at the level we want?
I mean, presumably if the Mass DEP has said, hey, we've set this level, someone's been able to detect that level somehow.
Where the level is set at the lowest quantifiable concentration the instrument can get to. So we're mostly,
Mass DEP sets it at the lowest level that their instruments can get to? Is that what you're saying?
right,
So
Yeah.
they're basically saying that any arsenic whatsoever is unacceptable, it's cancer causing. Is that what they're saying? Mass
they're
DEP?
being conservative in saying at this lowest possible level that for a cancer risk, there's a potential for 100 million people, or 1 in 1 million people to potentially have cancer, yes.
Sure, but I guess the question about the technology, is there a difference in the sort of testing equipment or testing technology that Mass DEP used to come up with this number of 2.5 versus the 3 threshold that you seem to get to?
So is there, I'm not quite understanding. So the level that EPA is set is what they're going as low as they can to be conservative.
I understand that. Can your
Yeah.
instruments go that low? And if they can't, I mean, are there any instruments that can go that low?
Without interference, they can achieve that.
I'm sorry? They can?
Without any interference, they should be able to achieve it. However, and we do ask for the MDLs as well, the detection limits, which are lower than the RLs. And in most cases, those MDLs have been below the risk level. But there is a margin of error for the MDLs, the detection limit. So therefore, the laboratory reports the reporting limit. But we then go back and ask for the MDLs. And in most cases, the MDLs are below that threshold.
Sorry, MDL?
Method detection limit,
The
yes.
MDL is what the EPA sets for a method limit.
Okay, because I'm seeing ND not detected above laboratory reporting limits, and I'm not seeing MDL. I just wanted to make sure I've got my nomenclature correct.
No, yep, so when
it's different.
when we have RLs exceeding our action level, our criteria, we then ask the lab if they can report the method detection limit, which is lower than the reporting limit, but there is a margin of error on the MDL. So that's,
Okay.
so they can't say with 100% accuracy that the detection limit is accurate. So then there's a margin of error that the lab sets and reports it as a reporting limit. I know it's
Alright.
a little complicated and a little screwy.
Well, you're dealing with people who are trained here in epidemiology and in laboratory science, so I mean, forgive us, but we do understand some of this at least.
Yep.
It would be great if we could get a little bit more detailed, maybe even graphical about these results that we have here today. What
Mhm.
exactly was detected, what the detection limit is, and what the minimum detection limit is.
Yes, so that's in our report. I apologize, I didn't go into detail here. The reporting limit for arsenic in 2025 was 3.35 milligrams per kilogram. The ELCR, the risk-based standard, is set at 2.5. So that
So what's the minimal detectable limit? Or minimal detectable level, sorry.
the minimal detectable limit for arsenic,
Yes,
The MDL from the lab. Do we get?
that was 0.5. So it was much lower than the 2.5 risk-based standard, the MDL.
so theoretically, they can detect down to 0.5.
But not with 100% confidence.
I'm sorry, right, so all right, so what are the 95% confidence intervals?
I think we would have to look into that. I don't know that off the top of my head.
Right, because basically we need to know is our number, within the 95% confidence interval or not, right?
Got it.
It sounds like we
So
probably,
that's asking the lab to opine on their confidence level, on their detection level. Is that what you're asking?
Well,
I think
I don't think I'm asking for their opinion. I'm asking for what
Yeah.
it is. They should presumably have tested this and should know what their confidence intervals are.
I think what would be useful is if on the same plot in the left panel, if we can have the confidence limits plotted for each of these data points, especially for the last 3 to 5 years. That's what we are looking for. So what was the median of their testing interval? And then what were the confidence limit, whether it's 90% or 95%? because that way we can assess whether these plots are within that detection limit or whether we are above that. I think that's what Steve will be useful for us to
Yeah,
understand.
I think that's what you want.
Okay,
Because it's very difficult to visualize, what are the detection limits of the assay itself? What is the lower limit of quantitation? What is the above limit of quantitation? So
Yeah.
all of that having on this plot is what will help us understand whether we are measuring using the right instrument or not.
So put your confidence
Yeah,
interval.
that should be in the lab report.
On each of those,
Yeah.
bar on each of those points with the confidence interval.
It should be in the lab reports. We can look into that.
Well, we have the lab report, so if you could tell us what page, we can take a look right now.
I'd have to look at the QA QC section.
I don't think we have a table of contents for this, well, it isn't. We have intro, methodology, results, data evaluation, and conclusions, which only go
So
to page
in-
4.
in
There's
the-
a whole
In the
bunch.
laboratory data, appendix A, I think is what you're asking for the laboratories.
Well, we have 21 pages of laboratory information, and then we have another 21-page report as well. These are entitled EMSL Analytical. I assume that's the laboratory.
so ASL Environmental ran the metals analysis, which includes arsenic. EMSL, they sub out to ALS for that analysis because EMSL's equipment can't achieve the concentrations that we are trying to get. So there should be a header with ALS environmental that has the metals analysis, and in 2025 it was run by a lab in Holland, Michigan.
All right, I mean, we have it. I don't see any confidence intervals around this. I'm looking at, I got the semi-volatiles here, metals, arsenic, total. RDL 39.7. There's a flag, there's a dilution. But I'm not really seeing an awful lot else.
Yeah, they're talking about percent recoveries, but they're not. Yeah, there is no confidence limits per se in these packages.
Yeah,
Yeah, there is no confidence interval.
so would it be possible for you to, get back to us on that one for next month?
We
Or
can
next-
definitely look into it.
Okay? Because
Can I-
that would be helpful,
That would be very helpful.
because we do need to know what's going on with the fields.
Can I also ask, are each of these data points generated by different labs?
I would have to look into that. I know we used EMSL every single time. They're who we send the samples to. They're in New Jersey. But then they sometimes sub out to labs within their network that they use. So I believe we always use EMSL, but I would have to look into who EMSL has then used beyond that.
We can look into other labs and see. So I do apologize. I am not a crumb rubber expert by any means. My career is mostly soil and groundwater. This is a little bit different world for me.
Well, I think that it's really just, we need some better notion of what the statistics are. I mean, it's not a matter of what it is. It's like, okay, a lab can detect something, it can detect it to a certain level. Is that level something we need to worry about or not? And what confidence do we have around that?
Yeah.
That's what we need to know. It doesn't matter if it's soil or crumb rubber or anything else for that matter. But we need those confidence intervals, and we kind of need to, know whether or not they could detect it to begin with, because otherwise this is an exercise in futility, right?
And this
Yeah.
should be on the lab that's conducting the analysis to
Yeah.
tell us that.
Yes.
I mean, I can understand you don't do that. You don't know that because you're not doing the analysis yourself. But the lab should be able to tell us that.
So we can follow up with Fuss and O'Neill and schedule maybe follow up for either July or August.
That'd be great.
And I think given the nature of this, we can also figure out if there's additional testing that's needed, or in the future we want a different process going forward. But obviously the spike in arsenic levels is a concern potentially.
Absolutely.
We do really appreciate your time though, and I know we had a lot of questions. We'll work to specifically put a couple of the questions in writing. I know we've said it a couple times, but we'll make sure we put it in writing just so there can be clarity between Fuss and O'Neill and the lab on what we're looking for.
Yeah.
Sure, and we're willing to meet and discuss with you folks whenever you want.
Yep, I think that's great. I think the value for us partially is, you know, you can tell the staff something, but we want to have the board members hear it because they're the elected officials responsible for the health of the community. So that's why we like doing it in a meeting like this.
Sure.
Got it.
We really appreciate your time though. Mr. Chair, I think we probably should,
Yeah, okay, so we'll send you a detailed list of what we're looking for and you'll respond.
Sounds good.
Okay.
Thank you very much.
Thank you very much.
All right, thank you. Have a great.
Okay,
Here.
so now we're ready for our public hearing
Yep,
on the nicotine pouches.
yes.
Okay.
Mr. Chair, might I suggest we maybe push back the fee schedule to later in the meeting? And we might decide if we aren't able to make up time to skip one or two other sections.
Sure.
Potentially include the staff reports. I believe Karen was going to start off, and we do have some folks online that are gonna promote.
Great, thank you.
Shed pans, sit updated. Okay.
This is updated as a way, because we got an updated packet from 2 days ago.
Yep.
Is this some more stuff? Beyond?
Yeah.
No, it's just a printout.
All right, oh, okay.
You want me to wait for you to promote those?
I'm in the process of promoting them,
Yeah.
just a sec.
Great, thank you.
207 is what it is.
you.
Yeah. Scroll. Scroll.
Yeah. There it is.
So Mr. Chair, you're gonna open the hearing, and then, Karen, you wanna start with the
Sure.
presentation and
Yes.
then we'll have time for public comments as well.
So I will declare the hearing on nicotine pouches open for discussion. And calling Karen to introduce it.
Good morning, thank you. I'd like to begin our discussion on nicotine pouches by briefly reviewing the steps the board and our department have taken over the past several months. You may recall in December 2024, the board voted in favor of adopting nicotine-free generation policy for Needham. And at that time, the draft of Article 1 for our tobacco sales regulation included language in Section G permitting the sale of oral nicotine pouches by adult-only retail stores. Since then, the conversation around pouches has evolved significantly. In February, the option for capping nicotine pouch products at a maximum strength of 6 milligrams was introduced. In April, the Needham Public Health Division conducted a comprehensive review of nicotine pouches, which we shared with the board. And the review, as you may recall, addressed their health impacts, concerns about youth access and use, and it examined how other Massachusetts communities are regulating these products. And in May, more recently, the board agreed to use the language for capping nicotine pouch products at 6 milligrams, and that pouches should be unflavored, FDA approved for marketing and evaluated to confirm that they're unflavored prior to retail sale. Having worked closely with the prevention team to conduct in-depth research on nicotine pouches, I'm here to respectfully ask your support to restrict the sale of nicotine pouches in Needham. As a substance use prevention coordinator, I can confidently say that the most effective prevention strategies begin with limiting youth exposure and access to addictive substances, including nicotine pouches. Evidence-based research consistently shows that reducing access and availability is a key component of primary prevention. In fact, the Community Anti-Drug Coalitions of America, or CADCA, identifies policy change such as this proposed regulation as one of the 7 strategies for effective community level change. We know that nicotine is addictive. We've talked about how the brains of young people have that nicotine disrupts the brain circuitry responsible for action, attention, learning, and memory. And we know that nicotine pouches are not a cessation tool. They're not on the list of cessation tools approved by the FDA. And in fact, Philip Morris International, which purchased ZYN in 2022 from Swedish Match, does not intend or sell ZYN products as a smoking cessation product. I quoted from their website that their ambition is to replace every cigarette for all adults who would otherwise continue to smoke with science-based smoke-free products, and that includes nicotine pouches. We know that nicotine pouch cessation products are available. They're safe and approved as such, and they're available at local pharmacies, so that we know that those are available to people in our community. We also know that the tobacco industry has flavored these nicotine pouches with the intention of capturing their next new customers, our young people. And that's how the industry works. We saw that with vaping. They hook new young customers with appealing flavors. They flood social media with Zinfluencers, individuals who are promoting Zyn to young people. And when we took a look around at our other communities in Massachusetts, we know that at least 9 communities are using the adult-only retail store language in their tobacco regulations to restrict the sale of nicotine pouches. I'll just close with this. We know that Needham is a leader in public health, and this board was the nation's leader for Tobacco 21. Other towns look to Needham as a vanguard of public health, and the board has this opportunity right now to be among the leaders who restrict the sale of nicotine pouches in Needham. I think there may be a couple of my colleagues in prevention that are here virtually. And if there's anything that they want to fill in, I'll let them do that. I also can share that Tara and Cy have followed through on all of the deliverables that you requested, the board requested in the May meeting regarding the testing procedures and such, and Lydia was involved in that as well. So if there's any questions that I may be able to address, I'm happy to do that. I don't know if Carol or Lydia wanted to just add anything there.
Good morning. I want to thank you all, and I echo the words of leadership and science and data adherence that the Needham Board of Health has brought us all to for many years in leading with Tobacco 21. And I hope that due to the fact these pouches are being accessed by youth, no matter the potency and no matter the flavor or not, which is very difficult and labor intensive to identify, that Needham can vote to ban them. In licensees, we know combustible tobacco is available in Needham, but this is similar to vape and the industry language. I don't want to take up time. I would like to say that Zendali DePina, who is a Needham High graduate and worked with me with the SAPSI grant, is, I believe, there in person. And I'd love to have her be able to speak because she went through BU School of Public Health and learned from Needham, and then is now working in tobacco for the state. So I almost like to cede my time over to her, and thank you all again for taking the time and steps to consider what we as staff hope that you'll do in banning the pouches to adult-only stores. I don't see it as prohibition because as cessation products, we have widely available pharmacy insurance-based patches that are efficient. And so I see that as the sound substitute. So thank you. And if Zendali's there, I'd love the opportunity for her to speak.
Okay, so then we recognize Zendali.
Yes, I think we definitely should recognize Emily. There are a few people that are in queue ahead, including
Okay.
Cheryl, and possibly Lydia, and then there's Peter Brennan has his hand, or two people online have their hands up as well.
Okay, so we'll take them in that order then.
Sure, Cheryl, Lydia, then we'll do the two online, then we'll do Zendali, then we'll do any other public comments.
Good morning. Thank you very much for having me. My name is Cheryl Sabara. I am the Executive Director and Senior Staff Attorney for the Massachusetts Association of Health Boards. And I know that speakers that are coming after me will indicate that these products are or can be used by adults who want to stop using combustible products. And while combustible products certainly are, the only consumer products that when used as directed causes death, these products are also concerning. And they're concerning because of the evidence that we have that youth are using them, and also the evidence that the sales of these products have increased substantially. And when we look at youth and how youth are using them, there are many reasons why youth are using them. First, they can be used very discreetly. You just put the pouch in between your gum and your teeth and your mouth, and they can be used in school. They can be used anywhere you want. They can be used at home. They can be used anywhere. There's no smoke that comes out or vapor. They're very small. They're in containers that look like mints or gums. And the thing that is very concerning also is that in data from last year, from 2024, they have become the second most popular tobacco nicotine product used by youth. Right now, or at least in 2024, there were almost 500,000 middle and high school students who were using these nationwide. The majority of them are flavored. And in Massachusetts, that should have provided some comfort to us because flavored nicotine products are banned in Massachusetts. However, when we've done recent flavor tests on these pouches, many of them, or if not, well, the vast majority of them, while they don't say on them that they're flavored, they have names like clear or chill or white. When you open them up, you smell a very minty smell. So there are many of these products that are not explicitly labeled flavor, but that are flavored, and youth know that they're flavored, and those are the ones that they're using. The concern about the strength of the nicotine is real. The low strength, which is one of the options that Needham is considering, is to ban ones that are over 6 milligrams. And, the industry says that they're not targeting them to people that are not already smokers, that they're not doing that. But when you go online and look at some of the advertisements for some of these products, you'll find that the ones in the lower strength are advertised as being there exclusively for beginners. I found one quote that said these are particularly beneficial for those who are experimenting with nicotine for the first time. First time, the plain meaning of first time means they're using nicotine through these pouches for the first time. And I would go back to the discrete nature of the use of these pouches, the potential for it being extremely discreet. So we have been in contact with EPIs at the Department of Public Health. they are doing more research on these products. We have also been in touch with the dental director for the Department of Public Health. We are reaching out to ears, nose, and throat doctors about these pouches as well. But we know that youth use of nicotine in any form is not safe. There are reports of gum problems, cardiovascular issues, neurological effects, and stomach problems with these products. And the marketing strategies are also quite troubling. And you've already heard about Zinfluencers. And then we see what the amount of resources that Philip Morris is putting into these products. So we have heard, and if adults think these are safer than cigarettes and want to use them, they're able to do that. But another concern we're seeing is they're not using them, and I've seen this, they're not using one pouch, they're putting in more than one pouch at a time that are dissolving into their stomachs. And we have not seen yet evidence that these are being used by adults in an effort to quit. We have not seen that evidence yet. So I understand and applaud what Needham is considering doing here. And I don't think limiting the amount or putting these in adult retail tobacco stores is going to stop adults that want to use these products. It's just going to protect youth, which is one of our primary goals in public health. Thanks.
Thank you.
Mr. Chair, we have three folks with their hands online.
Okay, let's take those first.
Sure. So Peter Brennan, you're up. Sorry.
Hey, can you hear me?
We can.
Oh, great. Peter Brennan, Executive Director, New England Convenience Store and Energy Marketers Association. I would oppose any ban, restriction, or otherwise, further criminalization and restriction on legal tobacco products that our adults like to use. A couple things that the previous speaker, Cheryl Sabara, said really jumped out at me, that there is clear evidence adults are using these products as a less harmful form of nicotine. Many people, when you see the increase in pouches over the last few years, that's a lot of people that have come from chewing tobacco. That's a lot of people that have come from smoking cigarettes. And I don't know how you can dispute that fact. I know Cheryl usually has a loose, relationship with the facts here, but that's just bold-faced untrue. So yes, people are using these to quit more harmful forms of nicotine. We don't think that restricting the nicotine content really helps people that are coming from a high nicotine source, such as chewing tobacco or combustible cigarettes. So you're actually doing a disservice to those looking to switch to a less harmful product when you make the nicotine content lower and lower in the pouches. Again, the flavor issue, listen, DPH has tests that they run, they have a list. Some items are certified as non-flavored, some are certified as flavored. I think we really need to look back at what an absolute waste of resources and time the flavor ban has been, because all it's done is enrich New Hampshire. The smoking rates are still the same. The menthol smoking rates are still the same in Massachusetts as they were. New Hampshire stores are doing great, and we love New Hampshire stores. But this is a huge impact to our retailers, because if somebody can't come to your store for the thing they want, they're going to go a town over. They're going to go to a state over. And then you lose the tank of gas, the whole basket of goods, the milk, the eggs, everything goes along with it. It's not just a nicotine purchase. So while in a vacuum, I go to a lot of these hearings, I know that people talk a lot about, okay, this is how we're going to save the children. This does nothing to impact youth usage. Youth are getting these products on the black market. They're getting them online, and they're really not using these products in any measurable numbers that would make one concerned. But, you know, kids are always going to find their way into something. We agree. That's why we card everybody to our registers. That's why we have almost 100% compliance rates with all state, local, you know, at any of my member stores, compliance rates are really, really good. So we oppose the measure. We do agree that Needham does seem to need to be doing a little bit more to protect the children, but I don't think tobacco usage is a primary concern. So thank you.
So, Mr. Brennan, if you have any, you made a number of assertions. If you have any data to back those up, we'd be interested in seeing them, particularly that, you know, a number of smokers, for instance, smokeless tobacco and oral tobacco have switched over to Zins. You made a number of other assertions, you know, regarding, you know, retail sales and people moving over. Any of that data would be most helpful. I would also just ask all the panelists.
I think that you guys would have data on compliance in your town.
We have our town compliance, but you made a number of other assertions about.
About a retailer statewide? Sure.
More general
Yeah,
about
I can track that down and shoot it over.
You generalized, so let's see some data.
Right, but in general, can we just, everybody should be addressing the chair, and there should be no ad hominem attacks. I appreciate that, thank you.
Thank you, Dr. Epstein. Mr. Chair, we have Ken Elstein. Ken?
Yes, thank you. I'm a member, this is now my 6th year of the Board of Health in the town of Belchertown. I'm a former select board chair and was president of the County Select Boards Association, which kind of gives me a unique perspective. About 18 months ago, the town of Belchertown discussed restrictions on nicotine pouches. At the time, I had considered quite seriously the option of 6 milligrams. But eventually, in the end, we voted to restrict it to adult-only stores, and since we do not have any adult-only stores, it was effectively a total ban. My reasons largely at the time were that it seems as though there's no such thing as a 6 milligram ban. As one of the previous speakers pointed out, you put one pouch in your left cheek, you put another one in the right cheek, that's already up to 12. You can do more than that. There's anecdotal evidence that some kids swallow these things, which is totally disgusting to swallow an addictive drug, but there's stories about that. They claim that they are not flavored. Merchants, some of whom are members of a previous speaker's organization, have told us that they trust the wholesalers to only send them stuff that's legal in Massachusetts. And we know flavored nicotine products are banned altogether. But in fact, they don't do it. So I would encourage him to get his act in order and have the wholesalers send only legal things. I really resent uses of the words criminalization, that one of the previous speaker has a loose relationship to facts. And the previous speaker also said compliance rates are really good. When we do our test checks, we have 10 licensed nicotine dealers in Belchertown. The last time we did this, 9 of them, 9 of the 10 had violations. Now that's hardly a 100% compliance rate. It's more like a 10% compliance rate. And we all know we don't have enough inspections going on. So one other thing is I spoke to our health director earlier this week and asked her what kind of objections have we heard from the public in the last 18 months that this has been on the books. And her answer was the first month, an out-of-town resident complained that he couldn't get pouches in Belchertown, and that's been the only complaint that she's received from the public in the 18 months. So I would encourage you to restrict nicotine pouches completely. Join us and the other municipalities that have done it, and eventually perhaps we'll be able to restrict it statewide. Thank you.
Thank you.
Mr. Chair, we have a few more folks. Lydia, I think you wanted to make a comment. We have Kalina, we have Isabel and Zendley in the room. So I guess start with Lydia, please.
All right. Lydia?
Thank you. I'll be brief because I'd love to hear from Isabel and Zendley. I'd like to emphasize and agree with a lot of what has been shared by my colleagues and by Attorney Sabara. A lot of what I've learned about these products has been through experts like Cheryl and professionals at the state and national levels through my work, which, as you know, focuses on youth substance use prevention and reduction. So we know, all of us, that nicotine pouches are discreet, convenient, affordable, often contain high amounts of nicotine, or can be used multiple at a time. We know manufacturers of these products are targeting consumers through rewards programs, marketing related to pop culture, celebrities, music, the use of influencers, all of which makes them attractive to young people. Cheryl also shared some statewide data about the sales of these products drastically increasing over the past few years, and current use among Massachusetts high school students tripling from 2019 to 2023. And that last year they were the second most popular tobacco product used by youth in the country or in the state. I wanted to look at Needham's data because I thought that that would be relevant to the board. So I reviewed the 2023 Metro West Adolescent Health Survey report for Needham High School. And I found that Needham's youth use mirrors this. Nicotine pouches are the second most common way that Needham High School students who currently in the past 30 days used nicotine or tobacco chose to, second only to vaping. And I'll keep it brief and leave it at that. Thanks.
Okay, thank you. Okay, Isabel.
I think Kalina and then Isabel and Zendley.
Okay, so Kalina. Are you there?
Hello, and thank you for giving me the opportunity to speak here today. My name is Kalina Michova, and I'll be a senior at Needham High School in the fall. And I'm also a student leader in SALSA, a club that focuses on substance use prevention and supporting healthy choices within our school community. I'm here today because of my concern about the rise in the use of nicotine pouches, especially brands like Zyn, among teens in our town. And as already mentioned, these products are being marketed as safer alternatives to smoking, but they still contain high levels of nicotine and harmful chemicals because companies are making them in flavors that clearly appeal to young people, and they're using ads and packaging that directly target us as students. At school, I've personally seen students use Zyns in bathrooms, locker rooms, and even leaving them in water fountains. And because they're so discreet and don't create smoke or vapor, they're much harder to catch, which makes it easier for students to get hooked on them without much adult awareness. And this isn't just something I've been noticing on my own. As already mentioned, according to the 2023 Metro West Adolescent Health Survey, about 3.3% of Needham high schoolers are already using nicotine pouches. And while that might sound like a small number, it really represents real students and health risks and this general trend of growing exposure, where nationally nearly 1 million students have tried Zyns. And I find these rising rates very alarming. What's even more concerning is how these products are disproportionately reaching students who already face social and health inequities, especially students of color and those from marginalized communities. And we've seen this kind of targeted marketing before with cigarettes. Thankfully, through policy and awareness, we were able to reduce smoking rates, but now we have another chance to act before this becomes an even bigger problem. As someone who's experienced this firsthand, I'm asking you to consider new regulations that would limit or mostly prohibit the sale of nicotine pouches in our town. And I truly believe that stronger policies can help protect youth and support healthier futures. I think I'll try to keep this short, so thank you again for listening.
Okay, thank you, Glenda.
Isabel and Zendley, if you want to come to the table.
My name is Isabel Tashi. I'm a resident of Needham. I live on 108 Newell Ave, and I'm also a rising senior at Needham High School. I first want to address what one of the earlier panelists said, Peter Brennan, about the impact of restricting tobacco and nicotine products on small retailers. A study in 2021 that I'm happy to share with all of you found that purchasing tobacco was the primary motivation for store visits for only 3% of consumers, and that restricting the retail availability of tobacco would be unlikely to have a pronounced negative impact on small retail stores. Furthermore, we're not outright banning all tobacco and nicotine sales, we're just restricting nicotine pouches, so the impact on retailers within Needham would not be profound. Additionally, as a Philip Morris executive explained in the 90s, the intent for nicotine and tobacco sales is that the cigarette will preempt food or even preempt food in times of scarcity on the smoker's priority list. So when we're thinking about small retailers, it's important, but the impact on them is not profound. Whereas when the industry is allowed to market products that are incredibly addictive to young people, we have to think about the economic impact on those individuals as well. As we know, and as people have already explained today, the industry's marketing strategy revolves around addicting young adults and young children, and then relying on the addictive aspects of these products to keep people buying well into adulthood. This is voiced through a Philip Morris executive as well, who explained that these products are a symbolic act. I'm no longer my mother's child. I'm tough. I'm an adventurer. And then as the force from the psychological symbolism subsides, the pharmacological effects takes over to sustain the habit. Coming from the industry themselves, the idea is to addict youth and then continue to have them purchasing products that will ultimately kill them. I think it's particularly troubling that Philip Morris is also the company that owns Juul and Zins. If these products are intended for cessation, which is clear that they're not, Juul was advertised on Teen Nick, and their ad campaigns feature heavy youth rhetoric. And only 1/5 of young adults who start these products used as a means to quit conventional cigarettes products. But I think, again, it's particularly troubling that Philip Morris is owning these alleged cessation companies and products because they don't want you to quit. When their business revolves around hooking young people and making money off of addiction that will ultimately kill you, they don't want you to stop using these products. They want you to continue buying, to continue to make them money. And again, that's what they value. In my high school alone, Zyn and nicotine pouches are incredibly prominent. I think the claim that nicotine pouches are not a big problem among youth is wildly untrue, and especially within our own community. I've seen people using nicotine pouches on countless occasions, and they're so discreet that you would never know that people are using them. Teachers don't know what they are. Every student knows what they are. I think I've told this story to you all before, but I had a friend who started using nicotine pouches her freshman year of high school. And she saw that they were labeled chill, so she thought that they would help her with her anxiety. So that's why she started using these products, and she found herself incredibly addicted. I also work in the Needham Middle School at Pollard, with a program where I talk to middle school students about leadership skills and advocacy, and it's not uncommon when I go into the Pollard bathrooms to see Zyn pouches in the bathroom trash. The industry is very good at what they do, addicting youth, taking advantage of youth, and it's really sad and heartbreaking for me to see that this is happening in our high schools and in our middle schools. The industry is willing to go to incredible lengths to push their products onto people, and they don't like people pushing out against it. And I think that you have all seen that through your work with Nicotine Free Generation. Even recently, earlier this month, I was passing out flyers for the Nicotine Free Generation policy in another town, and a consultant for nicotine and tobacco companies came up next to me and was passing out flyers against it. And when I was speaking with him, he was explaining that it was his job and this is what he gets paid to do, to advocate and push for nicotine and tobacco products. So the industry is paying people to push their products onto young people. They're marketing it towards young people. And they will go to incredible lengths to ensure that they will continue to be making money off of the addiction and ultimately the deaths of young people. Thank you.
Elizabeth, thank you. Question for you.
Yes.
Since you've seen a lot of use
Mhm.
and since these products in Needham and elsewhere are, you have to show an ID to get them.
Mhm.
Where do kids get these from?
They get it from older siblings. I think that's one of the most common things. Or a lot of people have fake IDs. I think that's super common, especially within the high school. On the middle school level, I do think it's primarily from older siblings or adults in the household or cousins or people who they can get to purchase these products for them. And yeah, again, I think like the nicotine-free generation policy will help with that as it gets more phased out with age and there'll be less older siblings who can access these and such. But I think that especially with like the fake ID problem in the high school, I think a lot of retailers just don't care as much and they're not willing to push against it, if that makes sense. But yeah, I would say it's very, very, very common, and I'm happy to ask too, friends and people who I know who are also getting these products, like where exactly they're getting from, if that's helpful.
I think fake ID problem is something we should be able to work on with the scanners.
Yes.
Right?
Should be.
Yeah.
Can I also ask another question, and maybe
Yes.
this is probably just a general one? It is concerning that the marketing and the retailing folks were standing right there handing out flyers. Did you mention this was on high school premises, or was it more in a public premise?
So this was for the town meeting at Bellingham, which was at their high
I see.
school, right?
Okay.
So I'm standing right there passing them out, and then he's standing right there passing them out. They're at all these meetings. I'm sure you guys have seen it through Nicotine Free Generation. And obviously people can advocate for causes that they believe in, but I think it's more common than that these people are being paid to speak out
Yeah,
against it, so.
Thank you. I would be concerned if something like this happens at Needham High. Hopefully
Right.
such folks are not allowed beyond their premises to actually hand out flyers at Needham. High.
Right, I thought it was shocking that it was happening
Yeah.
like at that high school. And yeah, it's shocking
Thank
to
you.
me, but yeah, okay, all it's under.
Hi, everyone. My name is Zendali DePina. I am currently employed at the Massachusetts Department of Public Health, where I work as a senior tobacco prevention program specialist for the Massachusetts Tobacco Cessation and Prevention Program. I am here today, though, as a private citizen. I attended Needham Public Schools as a METCO student. So from kindergarten through senior year of high school, I attended the school. I learned here, I studied here, I played in sports teams. I fully integrated myself into the community. And then when I was getting my Master of Public Health at Boston University School of Public Health, I worked for the Department of Public Health here with Carol Reed under the SAPC Mass Call 3 grant doing youth substance abuse prevention. I worked with Cy and Cheryl at our sniff test that we did a couple weeks ago, looking at some of these products in a more in-depth sense, sniffing them, tasting them, doing everything we could to determine whether or not they were flavored. And I also have worked with Karen in the past, or in my capacity working for the Needham Public Health Department. I've worked with Isabel. She works with the 84 or Youth Prevention Program that is funded by the Massachusetts Department of Public Health to kind of get youth involved in their communities, have them talking about these issues and educating their peers on the dangers of tobacco and nicotine. So I'm happy to be here in all of these capacities, but primarily again, as a citizen who loves this town, who has grown up adjacent to this town. I live in West Roxbury. That's where my parents live. That's where I grew up. So I was never too far from this town. I'm well aware of the history of this town being the first in the nation to pass a 21 tobacco law, which was a pioneer in everything in its own right. I was here during COVID when youth were really it was at alarming rates getting more into and trying substances. I was attending Needham Public Schools in the system when Juul came out. So I firsthand saw how that addiction ravaged my, community. A lot of my friends got hooked at that point, and to this day, they continue to use vapes. A lot of them now are hooked on Zyn. So there is a lot that has been going on in this town, but as I said, I'm very proud of everything that this town has accomplished. So I'm happy to be here today to kind of speak more about this. And everyone that has talked kind of in support of this effort, there's not much I can add. They've talked about the data, they've talked about the personal experiences, they've talked about the science, etc. But again, just here to stress that we all know Zyn, we know that it can range from 2 milligrams to 8 milligram products. You can use your own minds, your own thinking to determine whether or not you consider that cessation when it's offered in flavors, when it's advertised, when you're able to purchase these products and get rewards for free merch and other, raffles, etc. So really thinking about, do you want to sell this product? What, advantage does it have for the people in your town? It's mentioned that if you're looking to completely ban it to adult only, who that would really affect, it would only prevent youth from being able to access that, youth that don't have legal IDs to purchase that, youth who shouldn't be, even able to enter these stores to buy, adult only products. Flavors are banned in the state, yet we know that they are still coming in somehow through letters, through distributors. And we have to kind of use every resource that we can to determine whether or not they are flavored, which yes, can be a waste, but we know that it's something that we have to do to prove that these are flavored products and that they are violating the law that is set in Massachusetts. So again, I echo everything that everyone said, and I'm just here to support and kind of rally for this.
Thank you. Is there anyone else who has any?
Mr. Chair, there's no one else online. If I could take a moment, one of the things that struck me, I guess, in listening to some of the comments, I wonder if, and I have heard, and I think I largely agree with your comments about we don't want prohibition. I do wonder if restrictions on nicotine pouches is the same as prohibition, and I wonder if it's more, and a more apt comparison would be the choice that was made by public health departments and eventually the Commonwealth to restrict caffeinated alcoholic beverage like Four Loko. Right? It was not a prohibition on alcohol, it was a restriction on a particular type of delivery method that was determined to be dangerous. So I do wonder if restrictions on nicotine pouches would be a more apt comparison to that than to, the prohibition on alcohol that the country had,
Yeah.
which did not work.
I agree. If you fit the criteria, you're over 21 and sold only adult only stores, all right, you can buy it. That's not prohibition.
Yeah, I think, and sorry, I'm not on camera, everybody. I have some signal issues, but I think the idea of doing the dose-based restriction doesn't really make a lot of sense to me at this point. And I'd just be in favor of going back to where we were before about restricting it to adult-only stores, given all the information that we've heard over the past several months.
Yeah, I think the de facto is that they're not going to be sold anyway, because even the way we have it right now, the products have to be unflavored. Every single one of them has flavoring. And if you look some of the data, if you have to read the references on the slides that you guys provided, but if you read the references, they're inserting cooling agents and what have you. So to some degree, you're playing whack-a-mole, but clearly they are using some type of agent to make these, more pure, right? So the practical effect is that there is no product on the market right now that's acceptable for sale and eating. I think the question, just from, kind of the enforcement standpoint, is do we allow them to be sold in retail outlets, or do we not allow them to be sold in retail outlets? But as I said, I mean, it's kind of moot, because right now, none of them would be approved to be sold in any retail outlet in Needham anyway, right? So to some degree, it's semantics.
I do think it's, sorry, go ahead, Zach.
Yep, I can speak to that. So there are a couple that are they're questionable in terms of whether they're flavored or not. So there's no enforcement on those products. But the majority of them, the vast majority of them are flavored, but the manufacturers are saying that they're not.
Right, but and again, this just gets to like, how far down the rabbit hole we want to go in terms of, contortions or not. All of the ones that are supposedly unflavored and being marketed as unflavored have a cooling agent in it, right? So we could say, for Needham, no flavoring and no cooling agent. Yes, we are allowed under Chapter 111 to go beyond the Department of Public Health, right? So basically anything, sweeteners, I mean, a lot of them have sweeteners, a lot of them have cooling agents. I mean, we could, add that to the list of, that's not permitted. Effectively, you're saying, there is no product that's going to be sold in Needham. It's just, does it make sense to play this whack-a-mole game in my mind, or does it make sense just to say, fine, we're going to do the adult only, because the adult only right now is a de facto ban, and when an adult only store wants to come into play, then we're going to have to play this whack-a-mole thing, and maybe we go back to this, because frankly, if we could, have a list of everything, or basically, come up with the basket of, thou shalt not do any of the following, then it couldn't be sold in an adult only store either, which is even better than limiting it to adult only.
Well, I think that I sort of agree with you. If we ban the addition of anything to the product that would give it a taste of any kind, a cooling agent, whatever. So it could just be nicotine, period. And then restrict it to adult only stores. I'd go along with that.
Yeah, I mean, I don't know. I mean, right now, I'm just thinking that weighing the risks and benefits.
Yeah.
You know, that it makes sense to go to adult only at this point.
So from our perspective, I think that is helpful. I don't ever like to come to the board and say, I don't know that we have the resources to enforce things. I will say that I think our environmental health team works very hard. And you know, Cheryl actually outlined this in a meeting that we attended earlier this week, but sort of the way we have things set up and the way we want to function and provide due process, we have to sort of do an inspection, inform a store, potentially do a test, do an order letter, let them challenge the order at a hearing. There are a lot of steps that happen, even though we I think are well within our rights and will, you know, be successful probably 100% of the time. There's a lot of time and effort that goes into sort of ensuring that fair process and the opportunity for the business owner to be heard, which is appropriate, but it is time consuming.
Yeah, that's why I don't think we can, I mean, to sort of be almost micromanaging to make sure that the latest cooling thing isn't in there and you have to monitor that and this and that. I just think it ends up being a lot of work. There's always going to be something new that then ends up needing to be added to the list. I think just going with adult only is much more practical in that sense as well.
Yeah, that's kind of where I'm coming down as well, Tejal. And at some time, should the industry come up with something that truly does not have anything, we could revisit it at that time. But for right now, this makes the enforcement a heck of a lot easier. And the practical effect is exactly the same, right? As I said, there currently is not a single product on the market that if we do this right, would be able to be sold in Needham anyway.
I would want to unfortunately throw out one wrinkle, and I'm trying my best to channel a lawyer here, but our hearing notice said that the discussion and the potential revisions were around the nicotine content, or restricting the nicotine content of pouches. So if the board wanted to change and restrict only to adult use, I think we would be on better legal footing if there was a new public notice and potentially an additional hearing before a decision.
Yeah, I agree with you.
Yeah.
Fair enough.
So that would be, on my agenda here, there's a suggested motion that the Board of Health hold open the hearing on the proposed amendments, which would be adult only, to Article 1 to be further discussed and likely voted on at our next meeting, and have an open meeting at that meeting.
So you can choose to have a hearing at that meeting or just deliberation. I would suggest a hearing, just again, because we put a legal notice that said just restricting the milligram content.
Yeah, the notice has to be not just that.
To be broader.
Yeah, I think the argument about, multiple sins, it's like, that's a really good point. So.
Yeah.
I didn't realize you could put like 5 in your mouth at once.
Do you want to make the motion like that?
So, well. Do I have to make it, it's that to be a motion, we're gonna continue the hearing.
Yes, you could motion to continue the hearing, or the chair, I think, can actually unilaterally decide to continue the hearing.
Okay,
Right.
I'll do that. I will continue the hearing till our next meeting. And have further discussions on restricting the sale to adult only stores with an open meeting.
Great, thank you. Thank you to everyone who gave public comment. The board appreciates your input, so do we.
Can I just add one point?
Get back to Belchertown about it.
Thank you.
Real problem. They have 9 out of 10.
Thank you.
failing.
Tim, can I, whoop,
They could learn from us.
What happened? Sorry, I was in the middle of changing people's role to attendee. That wasn't intentional, Carol. No, I was starting to move people to attendee. I'm sorry, Carol. Well, let me find Carol back. We're back.
Okay, I just want to add one little sort of useless point of information.
Yeah.
When I was a kid, my mother
Hi.
used to use, okay, let's try.
Carol, did you have something you wanted to say? Carol?
yes, Yes, sorry. Hi. Trying to help my mom today. Yeah, so the decision by the board is that at this time, the Zyn pouches will be sold in adult-only tobacco stores in Needham. Yet, because the notice was about restricting the content level for legal belt and to tie that up, the hearing will be continued and the to let the public weigh in on having these products, the board's decision to be sold in adult only in Needham. I think you know what I just I lost connection. I want to reiterate the decision.
So technically, boards of health, at least by state law, only have to have publicly noticed hearings.
Now maybe you lost
about
me.
Title V. Okay, anyway, Board of Health technically only need to have public noticed hearings about regulatory changes to Title V. The board, because of its interest in transparency and getting public comment and feedback, chooses to publicly advertise and hold public hearings on any sort of regulatory change it's considering. So we technically could proceed. We're on solid legal footing and anticipating potentially a legal challenge by giving a new hearing or continuing the hearing and having a new hearing notice published in the newspaper that is more explicit to say the board is considering this specific change, not just changes to the milligram content of nicotine pouches.
Okay. And the board that I heard, and again, forgive me, is prepared to say nicotine pouches will go adult only tobacco stores in Needham. And in the future, as Stephen said, if there's a adult only licensee, then it will be revisited at that time.
Yes, although the board, is holding the public hearing open, can it continue to accept public comment? So yeah, it would be discussed at the meeting at the end of July or beginning of August.
Thank you. I'm sorry.
Okay, thank you, Carol. Let me just finish my thought.
Yes.
So my mother used to buy this stuff to spray on her roses to kill insects. It's called Black Leaf 40, and it was nicotine sulfate. So go from there.
Yes. So, Mr. Chair, with your permission, we'll take something slightly out of order.
Yeah.
We have Sarah Shine, the Director of Youth and Family Services here. The board had, and I'm gonna forget a little bit when it was presented, whether it was February or March. When Metro West Adolescent Health Survey data was presented, the board was interested and concerned about some of the youth mental health numbers, and in particular, questions about the impact of social media and mobile phone use on, teen mental health, the healthy body image, suicidal ideations, or self-harm behavior. So Sarah is the town's expert on that, and she came to talk to you a little bit about that.
Okay. So Sarah.
Thank you so much for having me. So I'm Sarah Shine, the Director of Youth and Family Services. I've been with the town for 7 years now, and I'm very glad to be here. We have seen youth mental health issues really raise in the town since I've been here. I think the pandemic had a significant impact. I think the other thought is that social media and cell phone use has drastically increased youth mental health as well. And so we are trying to, so our job is really to make sure that we're implementing services to combat the mental health crisis that we're currently in. I have an amazing number of staff members who have really tried to figure out how to do that. We analyze data, implement programming, offer clinical programs. So I'm first just going to go over a little bit about what our programming entails, and then talk a little bit about a recent initiative that I would like to implement around cell phone and social media use. That's okay. I don't know if you want to share the PowerPoint. But
We already see it.
okay, all right. So overall, so data we have We also sit on a number of committees and coalitions to make sure that we are very involved in the community and that we know what the current trends are. So our clinical programming entails individual and family counseling. We work very collaborative with Needham Public Schools. When we go in the schools, there are a number of students who aren't able to get to our office space for whatever reason. So we offer counseling in the community as well. We offer case management and crisis management services. That's drastically increased since the pandemic as well. We have a lot of families who are in crisis, not knowing how to manage various systems in order to get the assistance they need. We offer parenting supports, and then what we've done over the past couple of years is drastically increase our group programming. Because what we found is that our wait list was so long that we weren't able to get to everyone on the wait list. So we increased our group programming and have minimized our wait list significantly. So that every family that's contacted us recently has been able to at least get a consult within a week of calling us, which is a tremendous increase since us.
A tremendous increase.
The next slide is just a couple of the recent social skills groups that we've offered. Again, those groups are really tailored to what any given trend is at the time. So more recently, we've seen trends in youth struggling with their families who are going through divorce. So we've implemented a group to help that. We've had a lot of families who struggled with grief in their lives, family members who have passed away. So anything that's going on at the time that we see, we kind of implement programming to combat those needs. We also offer a number of enrichment programs. So we have some programs that are kind of ongoing. We have a volunteers on meeting program, a peer mentor program, a peer tutor program. The idea of some of these programs is that they are therapeutic in nature, but not necessarily clinical services, to really make sure that we're offering youth an opportunity to come in and have some enrichment activities. Two programs that I'll just highlight, mental health first aid. I and Karen Shannon are teen mental health first aid instructors, so we teach adults how to respond to youth that are experiencing mental health challenge or crisis. We have run those trainings over the past couple of years, and our thought is really as many people as possible that can get trained in this will know how to respond to youth that are experiencing struggles. And if we're a town that can have a majority of adults trained in that, then we'll know what to do when the youth is struggling with a mental health issue. Last year, we also started an initiative where we're training teen mental health first aid, where we're training teens how to respond to their peers that are experiencing mental health challenge or crisis. So we've actually worked very collaboratively with Needham High School and have trained the entire 10th grade 2 years in a row. So right now, about 50% of the student population is trained, with the idea if we run this every year, 75% of the student population. So that's been a huge initiative. The other one that I'll highlight is we have worked collaboratively with Needham Community Council and the Becca Schmelz Foundation, and STAMP has been part of that as well, to offer a speaker series to the community where we're trying to again find trends, find things that parents are interested in learning in terms of mental health, and offering community educational activities to meet those needs. More recently, last year, we were able to hire 2 community-based positions, a community training coordinator and a community-based clinician, to offer services in the community to find trends that the community needs around training. So we've offered varied curricula to address those needs, including a school refusal curriculum, and depression curriculum. So anything, again, that we're seeing now with our curriculum to teach not only our staff, to teach community members and parents. They've also worked really closely with library staff and park and rec staff. So again, finding a way to make sure that people that are working with kids know how to manage the crisis that we're currently in. I already talked a little bit about our community involvement on our PowerPoint. There's a list of all the committees and coalitions that we sit on. And then the last slide is a resource guide that we've recently created that if any community member scans that, they'll have resources to all kinds of things in the community and supports that they might need that we might not be able to provide. So the other thing I wanted to discuss a little more in depth is the cell phone use and some guidance that we are trying to coordinate and we're trying to have community members to become part of this initiative. So fairly recently, the Attorney General put out a toolkit for school leaders and communities around cell phone and social media use that you have in your packet. I worked really closely with Needham Public Schools on a report that the Student Wellness Advisory Committee gave to the school board around how the schools are going to address cell phone use in the schools. So how are the elementary schools going to manage this? How are the high schools, elementary schools, middle schools, and high schools going to manage cell phone use? Because it's becoming such a problem in terms of the correlation between cell phone use and mental health, in addition to the impact it has on learning. So I've attached what the school has recommended to the school committee. And what I would like to do is organize a group of community members to make some decisions on how, as a community, we are going to put out guidance to community members. What we're hearing is parents are really struggling with how do they manage this, what restrictions should be on their phones. Should they have them at night? Should they not? This is how youth are communicating. My third grader wants a phone. What should I do? So we're kind of fielding some of this on a case by case basis. And what we would like to do is organize a group of community members to come up with some guidance around this. And I've talked to Tim about potentially getting somebody in to help us coordinate this and come up with community recommendations.
We consider self-ban, number of states are already doing it.
In the schools?
Yes.
Yeah, the schools, if you read their report, they went and visited some schools that have the yonder pouches, which, you know, your cell phone has to go in and be in this pouch. And did talk about the ban. What they've recommended is in this. And they did a lot of research on what those recommendations were. So we are part of this group, and the school committee is, you know, making their recommendations for what they're gonna do. But they did consider that. Ultimately, that wasn't their recommendation.
Why not?
There was a lot of pros and cons to doing a full ban and taking into consideration what parents really felt like they wanted. And what they're trying to do is really, they want to focus on education and making sure they're managing digital wellness as opposed to doing an outright ban. So teaching kids how to do it responsibly as opposed to banning it totally.
I think that's fine for high school kids, because I think they have to use their cell phones for different aspects of even high school work. But for elementary school and middle school,
There is a bell-to-bell ban. So for middle school and elementary schools, the phones have to be off and put away from bell to bell.
Even the watches.
I believe so, yeah. For high school, not. I think for elementary schools and middle schools, they do.
and along the same lines for social media usage, are there any guidelines that are being put out for use of social media?
Well, so that's
During
kind of,
school hours or even outside school hours, actually.
yeah. So the school didn't talk specifically about social media in terms of specific apps. But that's kind of what I would like to do with the community recommendations. So what I'm asking today is actually if any of you want to sit part of this committee and be part of kind of developing recommendations that then we can bring forth to the community at a later time.
They won't take that home.
Yeah, love to have you. In this toolkit, they give guidance, and they did this for the schools too. I mean, it was a large packet, so I'm sure you didn't have time to read through it carefully. But it does have some recommendations, how it can be implemented, with the hope that we could use this guidance to really tailor it to what Needham should do.
Thank you. I think we would like to hear a little bit more, especially with some of the community involvement on social media usage. It's really coming out as a concern for just the overall atmosphere that it's developing within schools, within friends, within kids.
Yeah.
It's very dangerous. The trends, not just, I mean, I think have not seen data in Needham, but what we are hearing from other towns outside of Needham, it's only a matter of time that it will catch up. So we really hope that we can make our kids more aware of appropriate use of social media. So these actions would really help out. And any collaborations that the Board of Health needs to have at school committee, for example, would be helpful to hear as well.
Okay.
Thank you.
Yeah, I agree with that, Aarti. I think, collaboration with school committee would be good. And I was curious how you're recruiting people for your community group. I mean, obviously coming here is great, but are you putting out a call for folks to join that? Because I know this is a topic of conversation amongst parents on a day in and day out basis.
Yeah, okay. Well, this is my first meeting, so Tim and I just talked about it. This is my first stop, so, yeah, we're gonna determine how we're gonna reach out to the community to find participants in the school system as well.
That's good.
Thank you very
Yeah,
much.
thank you.
Thank you, Sarah.
Okay, Tim, what do you want, which way do you want to go? 'Cause we're running behind. You want to do the fee schedule?
I think it would be good to do the fee schedule if that's possible, and then maybe we punt on staff reports. That's okay.
You might have to do that.
So fee schedule, so the board had asked for a couple things, and I think Tara and Sai have been sort of going double time both on the fee impact and on the working with Karen and Lydia and the team on the nicotine pouches, but the board asked for some feedback on the suggested permitted fee list. The board also asked for what the sort of financial impact would be in terms of total revenue taken in. So right now I'm on right now I'm on page like 253. And Julie was kind enough to sort of run the numbers, working with Sai based on the total number of permits that we had per category. Obviously, there's a chance that, we had 10 septic system installations, and next year we might only have 8, or we might have 12. So it's an approximation, of course. But we ran the numbers with this year's revenue, or the last full year we have, versus if we use the new fees the board is considering. And so the sort of financial impact right now would be about a little under $6,000 less in revenue taken in.
About 7%.
Yep.
8%. Can you take it like that?
We can. As I said, the two deputy town managers both sort of said, the board should make whatever policy decision it feels is appropriate. It's not a financial,
Yeah, I mean, it's the town coffers, it doesn't part it directly.
right, impacts the general fund, but again, that in a budget of 200 something million, not including capital, 6,000 is not a huge number for them.
In fact, something else will go up somewhere.
I'm sure. I did think that there was some, the board specifically had asked also about if we moved from our historical way of permitting food service establishments, which was largely based on square footage or seating, seating for restaurants and square footage for like grocery stores or larger establishments, and moved to the risk-based fee level, which is part of the work that Tara and her team have been doing for, it's not quite a decade, it's like 8 years, on the FDA food code standards. And you can see that impact would be relatively modest. It would actually mean that we went down, we go down $75 would be the combined impact.
For level 1. Yeah, that's right, because, level 4 would go up, I see it.
Yeah.
Right, so I think the only other thing we talked about were, for some of these, there are some big jumps we talked about phase-in, or it's on the way here.
Yeah, so I think I did find a way. We did have a policy recommendation about where we'd start folks on the risk level, right?
Right, so some of the food establishments or risk levels are sort of elevated because we had some issues with non-compliance, so we raised their risk levels, and I suggest like dropping them back down to their true operational like risk levels. So like, for example, like Hazel's Bakery is a risk level 3, but they're really a risk level 2. So suggest like dropping, resetting all the risk levels to their actual like operational risk levels, and then the fees will adjust due to that. Most of the time we increase risk levels over time.
Yeah, so that's an interesting concept too, because that's also a compliance issue now, right?
Yep.
If you don't play ball with us, we're gonna have to raise your risk level, and by the way, if that happens next year, your permitting fee is gonna go up.
Yes.
Exactly, yes, yeah. I think that's a good economic incentive for some of these people
Yes.
to comply.
It also is somewhat analogous to when the board revised tobacco regulations a few years ago and developed the tolling period. It did, if there were more serious violations within a 3-year period, more serious penalties, but the board sort of set everybody's clock back to zero and said, okay, as of this point, everyone's got a clean slate, but here are the rules, make sure you're aware.
Yep. I agree. So I will make a motion that we approve this then.
So,
If we can do that.
we absolutely can. I did want to draw your attention to the handful of comments that were included starting on page 249. After consulting with Tara and Sai, we felt that the calculations we had done in terms of time did not quite represent the right balance on a handful of items. Most of the changes would be sort of for maybe Sai and Tara can do a better job explaining, but the average case is not that complicated, but when it is complicated, it's incredibly complicated and time consuming. So it's trying to find a balance to reflect that. I think beaver removal, for example.
That occurred once since I've been on the board, maybe actually twice.
Just had one yesterday.
In the past.
We had one on Wednesday.
Oh, really?
Yeah.
It's just, we're talking.
Or 3. I remember, like that down by,
Yeah,
I
it's right.
don't remember, off
One thing.
of Central.
Yep.
Right?
Yeah.
Yeah,
But even though those are challenging and time consuming, we don't think it is appropriate to charge $360 for the fee. We are recommending that the fee go up $25 instead of going up, whatever the math on that is, $285. There are other ones
there
that
are
were,
others that you're recommending a higher fee.
yes,
Are
and
we
that's
just-
where I think we wanted to have a discussion with the board. Sai, do you want to jump in on body art?
Yes, so for body art, really have had one permit so far. And the plan review process took the most amount of time, but the inspections not so much. So I think on an annual basis, when the real process should be a little bit would take less time. And I think it'll be comparable to a body work permit, kind of amount of time it would take to do a body work renewal on an annual basis. So we wanted to set it comparable to a body work license fee. So we made it $300 versus the $280 for body works.
It is also true that the body art we have is largely small cosmetic like microblading, right? Which is in theory, there could be an actual full tattoo parlor, which would require a lot more work.
Yes, exactly, or a piercer that could come in as well.
So I guess my question is, we had a question mark of what the fees should be for 26, right? And now you're recommending changing, so why? Because those initial ones were supposedly based on the amount of work.
Right, so for instance,
Changed their minds.
in the body art case, we have the market so far in Needham has only for microblading and sort of
Sure.
higher end spa type of sort of setting. If we did have,
So this is anticipatory in that case?
I guess it's trying to say if, you could permit a tattoo parlor, piercing establishment, or this microblading. And we want a fee that's kind of in the middle, because microblading is, and what we have is the simplest one. So our calculation is based on it being really, really easy, and it could be hard. So we were trying to find a middle ground.
Okay. So for ones that are small, I get that, but then you look at ones where we have a number of vendors already. So, hauler companies, we have a number of those in town.
Yep.
Right? We've had from 150 down to 40 to 100. Where is that sort of thing coming from?
Well, we had some noise complaints. That was one thing that took a lot of time and effort. They were having disposals occur out of the town noise ordinance law. That was a lot of work that came up with that example.
So
So
are these more just refinements then?
Refinements, correct.
Okay.
I think the demo permit Needham's demo process is more robust than most communities in terms of, because of the issue we had years ago with a company faking pest reports, we now call on pest reports, right, to make sure they're authentic. We very closely notice the asbestos abatement. That's often aside from noise, that's the other one that we get sort of complaints about from concerned neighbors is, are they doing this properly? Is there asbestos? Is it a danger to my family from floating in the air?
Yeah, I just want to make sure that the whole point of this was to reflect the amount of work that's done. So, I mean, if we refine that and it's still, this is a better reflection, that's fine.
Right. I think it did go both ways, like the 1-day food event permit, the numbers say we should charge 120. We think that's too much. It should be maybe a little bit more than it has been, but not more than double.
Yeah. So with those revisions, my motion stands. We agreed this.
We wanted to sort of call out these recommendations that are different than.
What we had seen before.
We need a second on that motion.
I'll second it.
Okay. Second, let's have a vote. Is Tejal still here?
Tejal's still.
Yep.
Sorry, trying to unmute. Yes.
Okay. Artie?
Yes.
Ed, yes.
Steve, yes.
Okay, done. Great, so we'll skip the staff reports and then we need to we'll skip the town goals, or do you want to talk about this?
Stop sharing. We have about 12 minutes. I guess I wanted to confirm whether August 8th at 9 AM works for the board, or we should find a different time.
Should work the meeting.
Right now it works.
It works for me.
Yes, for me too.
Okay, there you go. So we will reserve a room, and honestly, we'll hope it's not PSAB, because every time we meet PSAB, we seem to disconnect the owl at some point.
Tim, so it's going to be a in-person, not a virtual, because I know we had been talking that it could have been just a virtual, but sounds
I
like
mean, that's a good point. If the board prefers, we can do just virtual.
I'm fine either way. I just wanted to clarify.
Yeah.
I mean, if that's what people would want, we can do it.
I mean, I prefer in person, particularly because maybe the very contentious one, but right.
Yeah,
I think we should have it in person just because of
It's hybrid.
Okay. Chair, we do have a few minutes. I did want to try to get the board's feedback on select board goals. The board did give feedback last year, and I have also asked my team about this, and we're pulling together some feedback. One being that goal number 1 is healthy and socially thriving, and has, I don't think, anything really related to health, physical or mental. So, that's one of our sort of thoughts, but when items are incorporated into the select board goals, that often means that it's much easier to make a case for funding or resources or, public attention for something. So for example, what Sarah mentioned about doing a companion report to the school's report on social media use and policy, that's something the Youth Commission is very interested in. I think this board is interested in. That would be something that I would try to suggest in the select board goals, that, the town make a concerted effort to consider the, mental health impact of. So I'd put forth a goal language, and then I'd put probably an objective or 2 underneath it. And obviously you've seen it from both the Board of Health end and the Council on Aging end, but community nutrition, especially food insecurity amongst seniors that are living on fixed income, is something that we're concerned about. And it dovetails nicely with the work that the town may do to expand the facility at the CAF, or renovate the facility at the CAF. So I think, that's something that, unless this board tells me otherwise, I would include in the suggestions of select board, is that we need to work on community nutrition and food insecurity, especially amongst seniors.
seeing these goals, they overlap quite a bit.
Yes.
And, I almost want to, the way they make it, I think they try to include us only in healthy and socially thriving. While livable is housing.
Yeah.
Safe, well, if we have environmental disasters, I think, we have a role to play in that, which is also under environmentally sustainable, but, because they have climate crisis there.
Yeah.
But, safety is a lot of what we do too. I mean, septic systems, what have you. So I try to get us inserting to as many of those as possible.
And I think that makes sense. I want to throw out 10 ideas and see if, 2 or 3 or 4 get picked up. And some of them don't even necessarily need more money. I think, for example, we have the funding we need for opioid remediation efforts, and Karen and Angie and the team have been doing a good job on that. But I do think it's something that should be mentioned in the select board goals. I actually think it's something that we have a quick win on, right? But we're one of the few communities that has a municipally funded addiction recovery coach. So.
Yeah, I don't see a single thing. Is there a single thing here about substance abuse prevention?
Not right now.
Goals. That's kind of a problem.
It's an oversight, yep.
Yeah, big one.
So I think that's, so if the board has specific things they'd like me to include, I'm happy to include them. If they have just sort of topics of like, we need something on food insecurity or community nutrition, we need something on mental health, we need something on substance use and misuse.
We put an awful lot of time and effort into a lot of those. And ideally, the select board's goals would reflect the work that's actually being done.
I think that would also give them a quick win, because we're not necessarily asking for money on some of those. Some of them, we're gonna ask for money on some.
Yeah.
I do think one of the things that I'd like to try to figure out, and I don't know exactly how to word it, but we are seeing, given changes at the federal level and concerns about tough economic times at the town and state level, tightening of sort of the social safety net. Not that, Needham can health insure the uninsured or anything like that, but are there any resources, or could we do any new programs that sort of address some of those challenges?
So to answer that question to some degree, there are some things we should be doing probably. The Medicaid cuts are going to hurt people, and it's going to hurt Southeast Asia's town, right? The Medicaid funds a third healthcare in the country, about the same amount here in Commonwealth. Currently, for people who are trying to enroll in Medicaid, the resources that are available are through the hospital, through the financial counselors at the hospital. Which, if you've ever tried to access them, because I tested this, right? You get an answering machine and they don't call you back. The whole point of what they're, of what at least the House bill is, never mind the Senate bill that's going to be worse, but the House bill is basically, how can we make it more difficult to enroll in Medicaid so that people just won't do it, and therefore that we know that they're not going to enroll, we're going to save money, right? So that's what we need to combat.
Yes.
So I don't know if that's something that our department takes on or works with the hospital to get them to take this on, but
so
that's going to be an important thing if you want to talk about, hey, where do we need to move as things move on? And over the next year or two, that's going to be increasingly important.
Good point. I think so. We do have an Aging Services, the SHINE grant, which is the Medicare enrollment serving the health information needs of everyone. I do think that, one of the challenges with federal budget is we're getting partial funding for fiscal year 26. So I'm already sort of thinking about how do I string together enough funding to keep the staff that do all the training for the volunteers who work in 25 senior centers enrolling seniors in Medicare when they become eligible. I do think there's opportunity, though, if we had some resources to expand in that area, or at least to guarantee that we would always, regardless of if there's a grant or not, still train Needham's volunteers to help enroll Needham residents in the program. So I think there is
So
potential.
expand it beyond Medicare, so they can also help Medicaid.
Yeah.
And could we partner with the hospital folks and maybe do, I don't know, a community session and some other things, just so people know how they even would go about doing it? It's supposed to be, I think, you guys can correct me, but instead of annual, it'll be like every 6 months that people have to do this process. I mean, they're really trying to make it challenging, but I wonder if we could partner with the hospital folks.
I think it's definitely worth a conversation. And I think it's worth a conversation to staff, because we do have people that, you know, Medicaid is complicated, but so is Medicare, and we have grant funded folks that do that work.
Right.
Isn't that big a stretch to say, could you do Medicaid too?
Might be worth a conversation with Josh Tarski as well, who has been interested in coming to one of our meetings, so we should invite him at some point. But maybe this would be one of those topics is, you know, what resources are available at the state level, or what's the state coordination plan for making this happen? Because the hospital is doing it largely for the marketplace plans. I mean, that's their distribution network, and that's why it's the hospitals that do that, because somebody comes in, they're uninsured, it's like, okay, let's get you enrolled in something.
Yeah.
Is that plan still viable, or what are they gonna do to augment it? And Josh may have some insights, being our state rep on
Sure.
that one. Same thing with Becca Roush, if she's available.
Okay. Yes, we
I don't think Becca's ever been to like one of our meetings.
Not to my knowledge. Okay. Great. If the board has additional thoughts beyond sort of what we discuss, I'm gonna sort of take what we said and craft some into sort of goal language and maybe one or two objectives that are more specific. If you have any additional thoughts, if you could send them to me in the next week or so.
Okay.
I can make sure I get them into the select board and hopefully get them considered.
I was gonna ask you what you did.
I think my deadline technically is June 30th, but if I could get them by the 27th, then I could incorporate the feedback over the weekend.
Okay.
Tim, can you resend that, the select board goals again? Just so it's top of the inbox.
Yep. Absolutely. Okay.
It's 11 o'clock.
Yep.
Need a vote to adjourn?
Yes.
So move.
Second that.
Okay. Let's see, Tejal,
Yep. Adjourn, please.
all right. Ed,
Yes, I made the motion.
Excellent. So we stand adjourned. Thank you very much.
we'll see you August 3rd. Great, one way or the other.